Today we're joining you from Penn State Health. We're talking with Dr. Craig Hillemeyer about the collaboration between Penn State Health and Highmark Blue Shield. Dr. Hillemeyer, tell us about this collaboration.
This collaboration is a chance to work together with Highmark Blue Shield to make sure that we offer the people who live here in central Pennsylvania the choices that they deserve, both in terms of insurance products as well as their health care needs.
So people experiencing medical issues are already experiencing a lot of hardship. When you put yourself in their shoes, how does the convenience of a collaboration like this help?
People will be able to stay close to their home and be able to take advantage of those social and family support structures which are essential and part of the healing process. And they'll be able to access that by not having to get in the car and travel for hours to a metropolitan area where that care can be taken. We've been able to add providers in oncology, cardiology throughout central Pennsylvania. An example of this will be the Lime Springs site that we plan to open in Lancaster County. People will be able to essentially have all of their healthcare needs taken care of in the shortest amount of time, and oftentimes with just one trip during the day, which is a pretty exciting thing to be able to do. We also have programs that are really best in the nation in many areas. Our Children's Hospital is certainly award-winning. Our pediatric heart program ranks routinely among the top 10 in objective measurements in terms of outcomes, but yet at a value in terms of a cost structure that really is much less than many of the metropolitan areas that we deal with. So that's a pretty exciting thing to be able to do.
Dan, tell us about your role in the collaboration.
It's very rare for a health insurer such as Highmark to actually invest and collaborate with a great healthcare system like this. The typical model is usually there's some tension between the two for reimbursement rates, but here we're actually working together to try to actually solve healthcare.
So now Penn State Health and Highmark Blue Shield are going to be sharing data. How is that beneficial to the patients?
The idea of data for a patient can certainly help both their experience and their outcome. And I'll give you an example. If somebody is first accessing healthcare through their primary care physician, and then they have to go see a specialist, that information is now being transferred from one provider to another. And if you think about it, in the old days, people had healthcare records that were usually paper-based, and that might be transferred from one office to another. And having that central database and being able to transfer it is extremely efficient and important. And it actually helps control cost in the long run too. As a Blue Shield, we represent the Blues brand, but we're unique in the sense that we're collaborating with Penn State Health to the extent that we are. And it's unique throughout the whole country. All the other Blues plans throughout the United States are watching how this is developing here in central Pennsylvania. And the way that it's gotten started, I think it's off to a very fine future.
For more information on the collaboration between Penn State Health and Highmark Blue Shield, go to togetherforpa.com.